That's what's new. Dr. Al-Juzzi with you, and as usual, we'll be addressing one item out of all the items when it comes to the weight loss journey or the preparation to weight loss journey. So the topic of today is recovery. I think such an important topic. So recovery, how do we approach this? Very simple. Let's look at this. So recovery starts from the day of surgery. So let's say surgery here, day, and then goes on during the hospital stay, and then after. Okay? These are the three phases of recovery. So let's go back to the principles. Every single surgery we do is minimally invasive, whether it's laparoscopic or robotic. Patients have tight incisions. If you look on the side here, this is the belly, and I'm sorry if I'm drawing it this way. The head is here, legs are here. We most of the time make 1, 2, 3, 4 incisions. And a little incision here, which is mini incisions. So these incisions are so small that the pain is very minimal. In other words, most of the patient recover so well that they are able to walk right after surgery. This is a day of surgery. They are able to walk right after surgery, and they are very much encouraged to walk as much as possible. Walk on the floor means not just in the room, but the entire floor, and walk as much as possible. There's no limit to how much you can walk, and it's not timed. And most of the time, patients don't need any help. They can rely on, well, they can just use the pole of the IV fluid as a, not a can, but as something they can stand. Initially, they can stand not on, but kind of rely on, and then as they make few laps, they feel so comfortable that they keep just pushing or pulling that pole. So that's one thing. So once again, this is really meant to, the first day is meant for the patient to recover, recuperate, and mimic what they would do at home. So there are really three things that happen here. So people or post-surgery patients do walk, and they do deep breathing, and they also do drink. Three things. I always like to say that. Walk, breathe, and drink. Walk and breathe and drink. So they walk as much as possible. They breathe deep breathing, which is 10 times an hour. There's a special device called incentive spirometer. And they drink. They drink the liquid diet, the bariatric liquid diet, which is through little cups of 1 ounce each. So this very first day will determine the journey. If you do superbly well, be able to go home the next day. If not, you will stay 2 nights in the hospital, and you keep redoing the whole thing. And when you're ready, you go home. And that's basically day of surgery, and that's hospital stay. Okay? So think about it. It starts here, replicates here, 1 or 2 days, and then you're home. This is really, this is across the board for all patients. Then we are left with a afterward. What happens after? So after, when you go home, there are things to do, things to not do. And in a nutshell, patients are allowed to shower anytime. They're not allowed to bathe for about 2 weeks. No swimming and no sitting in the jacuzzi for about 2 weeks. They can drive if they are off any pain medication, and most patients take the pain medication for about 3, maybe 5 days at most. You can walk upstairs, downstairs. You don't exercise. It's a no-no for 6 weeks. Okay, so this is for two weeks. You don't exercise for 6 weeks. And then you go through the diet, and the diet is pretty straightforward. The first week is, so it's structured this way. So week 1 is liquid diet, week 2 is baby food, and then week 3 to week 6, which is 4 weeks here. So 3, 4, 5, 6 is 4 weeks. And this is soft diet. Okay? What else? Follow-ups. Follow-ups very important. Patients follow up with me week 1, week 6, week 12, months 6, and 1 year out of surgery. So all this is the recovery. And patients are not supposed to be lifting anything beyond 10 pounds for 2 weeks. All right, let me take you to something else that's very important and I get a lot of questions about. So patients ask me, when can I go back to work? Very, very simple answer. Most of my patients, at least, let's not generalize this, most of my patients need that precious week after surgery to kind of recover. I mean, they're walking, they're drinking, they're breathing, they feel good, but they really want to feel themselves. So I say for 1 week, they need to kind of be off work and recuperate. And then here's the thing. It may take another week before they can go back to work. If they are in, I don't know, construction, any manual work, they may need to take another week. But for most people who are desk job or desk-based kind of work, after a week they feel so bored they want to go back. Obviously, if you don't feel that bored, you can take 2 weeks and then go back to work. But after 2 weeks, you are able to lift anything beyond 10 pounds. You're able to do most of the things that needs to happen. And then patients are very happy. And I see them here. I see them at 1 week mark to make sure that they are really good, and then they can carry on their journey. So this is really in a nutshell, the recovery. And I'm sure a lot of people have more and more questions. I'd be more than happy to address all these questions. So feel free to inject and add comments with questions, and I'll meet you next time through another video. Take care for now.